Hello, this is Cedric Gravel, and this is part two of Cushing's disease. So, as discussed previously, the hypothalamus releases CRH, which signals to the anterior pituitary to release ACTH, which then tells the cortex of the adrenal gland to release cortisol. Cortisol then inhibits the production of both CRH and ACTH in the hypothalamus and the anterior pituitary, respectively, resulting in a negative feedback loop. However, in Cushing's disease, the growth of the pituitary results in the pituitary not being able to detect the amount of cortisol present in the body. As a result, the anterior pituitary continues to release ACTH, which in turn results in an abundance of cortisol in the bloodstream. Symptoms. Due to the fact that people with Cushing's disease have elevated levels of cortisol, most symptoms of Cushing's disease are a direct result of these increases in cortisol levels. Excess levels of cortisol are commonly associated with facial redness, purple stripes on the abdomen, spontaneous bruising caused by thinning of the skin, back pain, mood swings that may lead to anxiety and depression, acne, and weight gain specifically in the abdomen and buttocks, leaving the extremities thin due to a loss of muscle mass. Diagnosis for Cushing syndrome can be generally simple, as urine tests and saliva tests are used. For urine, if the cortisol levels in the urinalysis are high, the doctor will then order subsequent specialized testing that determines whether or not it is in fact due to Cushing syndrome. Normally, the cortisol levels drop towards the end of the day. However, in people with Cushing syndrome, the levels remain the same, so saliva is analyzed both in the morning and at night to view the changes or lack thereof of cortisol levels. Technology is then used to determine whether or not Cushing's disease is a problem. Computerized tomography scans or magnetic resonance imaging scans are done to provide images of the pituitary and adrenal glands to detect abnormalities such as tumors or adenomas. Cushing's disease is treated with surgery. A tumor of the pituitary is removed by a neurosurgeon who removes the tumor by entering through the nose. Post-operation, cortisol replacements must be taken until normal cortisol levels are reached again. Radiation therapy is then used when the tumor cannot be fully removed or when the patient is not eligible for surgery. And that was Cushing syndrome. I hope you enjoyed.